Effectively, what we thought about is from the perspective of the citizen, what do you want when we talk about the first point that we have decided anonymity. When there is such a collective issue, and of course, one vote, one call, or maybe even one complaint won't do much. How can people even have the motive to respond to the government and to their roles with respect to healthcare? First of all, we want the basics completely covered, as from the perspectives of the citizens. Anonymity is paramount. We need it. I don't think anyone would trust giving their opinions to surveyors or whatever method we're using. The point is about community representatives. Now, of course, from the perspective of the state, they need to expand their reach to all the job cramming, etc. We have to understand already lots of organizations have that reach, so we need to utilize that, whatever the research team and the other teams have decided. The next one, introducing a reward system. This is a very different idea, but one of our team members suggested that maybe we could have a bounty hunt where students would basically go to pharmacies and take the drugs and test the drugs themselves, and they're going to get a bounty from the state, which is a very wild thing, but could be considered, who knows. The last one is independent audits of hospital performance. That's probably something pretty reasonable. We could have representatives from independent organizations that take surveys of people who use hospitals at the end of the day. Should be pretty easy. Then there's public database and health card. The health card is a pretty interesting concept, has been tried in quite a few places. Pakistan has the 𝗕𝗏𝗏 card, which has seen decent usage after, I think, 2018 or so when it was released. So yeah, these are the things we have added. I'll ask someone else to add anything I might have missed. So yeah, thank you.
Thank you. Anyone else want to add anything from this team? আপনারা আর কিছু বলবেন এটার সাথে? হ্যাঁ, সামনে আসেন।
I think one of the most important factors is that reaching out to the elderly club. That can be the exercise group that we see in the morning in most of the parks that we have. Reaching out to them about the healthcare, about whether or not they have any healthcare concerns, how we can serve them better. Because these are the people that most of the time do not know how to access the online services that the government is very proud of. But at the same time, they require someone trustworthy to confide to. And it can also be our Tonir Dokan, because they have a lot of adda sessions, there are a lot of impressionable people, and definitely face-to-face interaction can have a lot of impact. And I want to talk more about the second point as well, community reps, and I've seen this in my mom's hometown in Murshidabad. So in a lot of community, a lot of women, average women in the community join the government healthcare systems, and they work as healthcare providers. They go to, for example, their neighbors' homes and a lot of other homes in their community. And the moment in time when the patients see that someone, maybe their neighbor or maybe their female friend, is coming to them, someone who is trustworthy, is talking about their healthcare rights, is talking about what healthcare amenities that they can access, there is a level of trust, there is a level of clarity, and they feel more comfortable to share about their problems, something that they will not be comfortable to talk about in online, because rural women do not know how to use that. And secondly, especially to government officials, who might seem quite scary most of the time, but when we have community reps, women talking to vulnerable women who do not access these services, it does create a lot of change. It does create real grassroots data that a lot of the specialists and limited bubble specialists do not have access to. So definitely these are the demands of the citizens, and we think that this gives dignity to the citizens while giving them the rights that they can access.
Excellent.
So, yeah, that's about it.
Well, thank you. Thank you. Citizens team দের জন্য কোনো প্রশ্ন? Any suggestions? একদম না? একদম পারফেক্ট নাকি কোনো কিছু আছে যে আচ্ছা আমি এই হেলথ কার্ড জিনিসটা বুঝতে চাই হেলথ কার্ডটা কি আসলে আমি বুঝি না
It's basically a card where that sort of gives you the right to get healthcare. It might seem odd because it's basically a ticket to free healthcare, but in poor countries like ours, you have to target your healthcare to the demographics that need it the most. So it's just a way to differentiate whether it's the elderly or the very young. Some people will have health cards. It's a very crude summarization, but yes, it's just a way to target it better.
Okay, great. And
I'll just add to that.
Oh yes, please.
Can also make sure that people who are very vulnerable, who are poor, for example, and might not be able to pay the same bills that a middle-class person can pay, can have those cards to tell the healthcare providers that they cannot afford to pay the same bill, but they also want to access the healthcare amenities. So definitely, it might be like a ration card system of India, but for health.
Thank you. That's really helpful. Acha, apna jodi, if you go to the 𝗕𝗴𝗃𝗀𝗃 Health Complex, how much do you have to pay? Keu jane? Did anyone here ever go to the 𝗕𝗴𝗃𝗀 Health Complex? 10 টাকা, 3 টাকা, ওরকম কিছু token. Keu jane? 10 টাকা, 10 টাকা, 10 টাকা. ঠিক আছে. It's a token amount. তাই না, বেশি না. Okay. তো আর মনে হয় না যে cost is such a big, মানে ওই ধরনের সেবা পাওয়ার জন্য cost আমার মনে হয় না. It's maybe সেবার মানটা হয়তো সমস্যা নাকি? আপনি কিছু বলবেন? হ্যাঁ, নিশ্চয়ই।
ভিজিটিং এর যে ফিটা সেটার জন্য প্রবলেম না, দেন হচ্ছে মেডিসিন অ্যান্ড টেস্ট ওইটার জন্য তো অনেক বেশি লাগে, তো ওইটার জন্য
আচ্ছা, সেই জন্য আচ্ছা, হ্যাঁ, যদি কোনো চিকিৎসা বা ওষুধ বা এইসব। Okay, great. Thank you so much. That's great.